My first job, very first job in high school during the summer was working at the Cleveland Clinic in cardiac surgery. The first time I saw heart surgery, it was Toby Cosgrove doing a mitral valve operation. I thought, that is flat out amazing. I've got to learn how to do that. Well, not so fast. It took 20 years to learn how to do that. In the beginning of heart surgery, when a mitral valve didn't work, the valve was replaced. And then a group of surgeons, including Dr. Cosgrove, realized we can actually repair many of these valves. And when we repair the mitral valve, and sometimes the aortic valve as well, we're able to preserve the patient's own natural valve. And of course, your own natural valve is virtually always going to be better than a valve made out of metal and carbon. So restoring the person's own anatomy really gets them closer, maybe all the way, to restoring normal life.